Hello, good evening, Bustmob. Again, this is Dr. Hunter, and I am one of the surgeons of the Amelia status group here in Raleigh. And I wanted to let you guys know that I'm coming to you live from this Bustmob Facebook page. If you do happen to be watching this on Instagram, then I encourage you to join the Facebook main group, Bustmob.com. It has a lot of information regarding kind of the whole journey for breast surgery, for some body contouring, and just lots of, it's a great resource for, just support through the entire process from the beginning of surgery, lots of education, and then support kind of after you've gone through with surgery in terms of kind of the healing phase. So anyway, I encourage you to check that out, bustmob.com for the original Facebook page. So we're going to answer a couple questions. I kind of will jump into it and I kind of will just roll through. If you happen to have any other questions that you want to add, anything that's on your mind, just add it and I'll roll through here and then we'll get going. All right, so first question we get is from Courtney. And question is, do you compress with the Faja in the first 2 weeks for a tummy tuck or after? And how do you get proper blood flow to the area and how to prevent blood clots in the legs? So that's a bit of a complex question, but it's a really good question. So I'm going to take it kind of step by step. So compression for a tummy tuck. I actually do like compression for a tummy tuck in the beginning. I don't think that it really has if it's too tight, right, to the point where you feel like you can't breathe, then I do think it could cause some issues with regards to blood flow, particularly if it's in someone who is, like say, someone who was smoking or for some other reason why they kind of have limited blood flow in the beginning. Then obviously too tight a compression could lead to some concerns, right, because pressure does kind of limit blood flow. But for the most part, with the way that we do ours here, I actually put you into a binder or in some sort of kind of compression garment, if you will, the day of surgery, and you stay in a tight one for about the first week, and then we switch you into something that's a little bit more loose. So if you chose to wear something that was tight compression for the first 2 weeks, I think that's fine. We tend to tell people that after about 6 weeks, they can kind of get rid of all the compression that they want. However, I have a lot of patients who enjoy the way the compression feels. It's almost like a safety or a security blanket kind of after it's been on for a while. And they don't quite like to get rid of it. And so as long as it fits well, right, I think that the big thing for garments is they have to fit well, meaning that in the beginning, not too tight in the sense that if you feel like you can't breathe, then you need to loosen it, right? That's the gist of it. And then as you move forward, if it's creating these weird folds, wrinkles, you can kind of see lines from the garment in your, kind of in the skin. Those are things that you don't really want. And so in that regard, you either need to get a better fitting garment or you need to get a different type of garment for moving forward. So now the next question is proper blood flow to the area and preventing blood clots in the legs. So for your legs, you need to be up and be moving. So we tell patients that you got to be walking the day of surgery. You got to be up and you got to be moving in order to limit that. So that's simple things. Walking to the bathroom, walking to the refrigerator. I tell people I encourage family members to have you get your own drink, right, kind of thing, so that you're up and you're moving. Just something to make you move, because it's the sitting still, it's the kind of stasis, as they say, that increases the risk of blood clots in your legs. So we want you moving. Sometimes places will send you home with little squeezy boots that have batteries in them that will last you for about a day or so, and I think that's pretty good. Here we also use kind of compression stockings that I have patients stay in for a couple of weeks, so it just kind of adds a little bit of pressure to help some of the blood return from the legs. So I think those are kind of things that are important, but really you just got to be moving. That really is, I think, the biggest thing. After surgery, we want you up and we want you moving. All right, so next question. If you lose more weight after a tummy tuck, will the skin stretch back or will it need to be redone? This is actually a big thing that I think that comes up, or something that I try to focus on with patients. So when people come in and they're interested in a tummy tuck because they say that they've lost weight, really I want to know, are you at your goal weight, right? And as long as your BMI is within a certain range that people think is safe for surgery, I don't really have a target weight for you. It really is about what you want. And so if you're wanting to lose 5-10 pounds, perfect. Do the tummy tuck at that time. If you lose an extra 5-10 pounds afterwards, I think you'll be happy with it, because your skin will then contract. You will, I think, just kind of look a little more lean, and people tend to be happy with it. After about 10, you start getting to 15, 20 pounds. If you lose that much weight, then you kind of are back in the same situation where a lot of people are when they come in for a tummy tuck. It's like, I lost a lot of weight and now I have all this excess skin, because the skin, particularly as we get older, will only shrink back so much. And that depends on each person, right? People who have stretch marks, the skin shrinks back less because the skin has been damaged. For people who are a little bit younger, don't have stretch marks, then you can expect your skin will tighten a bit more. But that's all kind of up in the air. Nobody can really tell you how much your skin is going to tighten. So a short answer to that is 5 to 10 pound weight loss after tummy tuck, perfect, no problem at all. More than that, I probably would wait until you get closer to your goal weight and then say proceed with the tummy tuck or anything that's going to result in any skin excision. So that way you don't have to redo it. So that's that for the tummy tuck and the skin. Next question is, what happens to the breast tissue in a lift versus a breast reduction? And I think this is a great question because I always explain this to patients that a lift and a reduction has almost the exact same incisions, right? So what is done on the skin on the outside looks the same, right? So you have a lollipop breast lift, you have a lollipop breast reduction. You could have an anchor pattern breast lift and you can have an anchor pattern breast reduction. What's different is what happens underneath. And so the whole gradation from lift to reduction is really just kind of a continuum or a spectrum about how much tissue I take off. So if my goal is not to take tissue off, but my goal is to just lift the nipple, maybe make the breast more round, maybe tighten the breast a bit, then that's going to be a lift. And I'm going to take out some tissue, but the only thing I'm going to take out is the tissue that's underneath, right? The skin excision. I'm not going to try to take out any more because really I just want to be able to close that in what we call pillars, but I want to be able to close that so it's nice and it's consistent and it is consistent thickness and it's uniform. So that's a small wedge of tissue that's kind of just in the center because most of my lifts are lollipop. However, if I'm doing a reduction and it's a lollipop, my goal in that entire time is it's more than just lifting the nipple or more than just making the breast more perky. It's about getting out a significant amount of breast tissue. So instead of just this sliver here at the bottom that I take out in the lift, I'm going to take out actually this sliver plus a lot of lateral breast tissue that women tend to not enjoy because it makes the breast just feel more wide. So I want to take out a decent amount of tissue at the bottom of the breast and a decent amount of tissue on the side. And so, again, same incision, I'm just taking out way more breast tissue because the breast is larger. And then where it goes to, if that happens to be part of the question, what happens to it, it depends, right? If it is a reduction into a decent amount of tissue or a significant amount of tissue, then I will say that I have a conversation with the patient about whether or not they want to send it to pathology to have it checked. And so for women who are of age where you're starting to get mammograms, I tend to encourage them to send that tissue more so. Just so we can make sure there's not something in there that we would have tried to catch on a mammogram beforehand, but you just like to check to make sure. For people who have a higher history of, say, breast cancer in the family, I like to send that. Or people who just otherwise are concerned, I like to say I'll send it. And for the most part, when I do breast reductions, I do encourage sending it. When it's a lift, if it's a small amount of tissue, I don't think you necessarily need to send it because, again, it's a very small sample. But again, for people who have a history of breast cancer in the family, or they have some other concern, then certainly you can send it. And you send it to pathology, and the pathologist then does a review to make sure that it doesn't have any breast cancer or anything else that would be concerning within the tissue. All right, so that's that. And so the next thing is, and that's a question from Ridge M. So this one is from Gunny, and I think last name maybe is Barquez. I have mild ptosis, but I want the augmented look. I was told I could not go higher than 300 cc's to do my lift. My plastic surgeon said options are 300 cc moderate with lift or 470 cc high profile without. Which would you recommend and why? This is a great question, and I think that I have actually changed on this a bit as I've kind of gone through my training and my practice. So the first thing is, I don't know that I subscribe to a school of thought that says you can't go higher than, say, 300 cc's, 400 cc's, whatever. For me, in my practice, I like to figure out what it is that you want, right? Like my job is to make you happy, right? As happy as I can. I need to be able to help shepherd you on this process, but it's not for me to do what I think is the greatest operation. It's to do what is going to have you think it's the greatest operation, right? And so if you want larger than 300 cc and your surgeon limits you at 300 cc, I would say maybe talk to another surgeon possibly, and figure out why. Because is it that they don't think it will fit? Because if they don't think it will fit, that's one thing. But for some people, they have kind of just strict cutoffs for themselves for various reasons, which I wouldn't argue with, that they just don't like to go over a certain size. So let's imagine that you are a very small female, very petite, right? And very small weight, you're kind of short in stature, and you wanted like a massive implant, right? Say 700 cc's. I would then have to have a conversation with you and be like, I don't know that I can get that to fit, right? I understand that you want something large, and so I will try to get in as large as I can, but I have to be able to close things. So anyway, so that's just kind of my little bit of a hang up with saying that people won't go higher than a certain size with the lift. The problem with the lift and an implant at the same time is because it's opposing forces, right? An implant is going in and it's pushing on the tissue from the bottom. And we talked about blood flow earlier with the garment and the tummy. It's the same thing for the breast, right? So a large implant is going to squeeze some of the blood supply. And so then when people do a lift, people then get concerned that I have this big implant that's underneath that's pushing out. And now I'm going to push in, right, with the lift. And so those are opposing forces. And so obviously it is true. The bigger the implant, then the harder that kind of opposing force is. And so people then get concerned about blood flow. I think that if you have a big enough pedicle, meaning where I'm getting blood supply from, I tend to be okay with that. So I will actually use a pretty large implant if that's what the patient wants. We just have to have a conversation about what are the risks and what is it that you actually want when you're going from this. Why do you want the larger implant? So if you want an augmented look and you have mild ptosis, right? There's two things you just told me. So you probably want more upper pole fullness and your nipples a little bit low. You probably need a lift, right? What happens is, and we all kind of see this, where people will use a high profile implant, they'll use a big implant. And what happens is that when you use an augmentation with an implant, it takes your breasts and just makes them larger. And so for some women, if they like a more natural look, they like that the breast is a little bit lower, they like where the nipple position is, they just want more volume, Augment Only is perfect for them, all right? And I do that. And I don't try to encourage anybody to go away from that if that's what they want. But if what you want is more upper pole fullness and your nipple up, there's no type of implant that's going to do those things for you. You need a lift, right? And so with that, I'd say just to come back around and answer the question, without seeing any pictures, sounds like you need a lift. And then sounds like you might want to talk about using a larger volume implant with your surgeon. And so just keep that in mind. Implant is just for volume. Implant will give volume at the top, it will give volume at the bottom. It just gives volume. For changing things like the shape of the breast, making it more round, lifting the nipple, you need a lift, right? And so no implant is going to change really the position of the nipple. You can get a slight change elevation with a little bit of a kind of profile of the implant, but it's so subtle that for most people, it doesn't give them what they want when they say that they have some ptosis and they want a more augmented look. So that's the thought for that. That's a really good question, and I think that's something that we all go through a lot, and I see a lot of that on Bustmob. But I think it's certainly useful to try to point that out and try to distinguish what the difference between those is. All right, next question. So what is the difference between implant profiles? And so this is the thing we just talked about. And actually, I like this question, and I like kind of this topic because it comes up a lot. I get a lot of people who say that they want a high profile implant because that's what they read online. They think it's the best implant since sliced bread, and that's what they want. And for some people, it's a perfect implant. But for other people, it won't do what you want it to do, right? So profiles are, if you imagine that this is a straight line right here, and so you can have from here, you can have a low profile implant, you can have a moderate implant, you can have a moderate plus, and you can have a high profile. But then what happens is that it's not just about the profile, how it comes off of the chest. That's what profile means. It also is about the width of the implant, because I can have an implant that is really wide, like a moderate or a low profile. Or I can have an implant that's more narrow, and that's like a high profile. So if you do the exercise kind of in your head where you have this container, right, and it is, say, 100 cc's, there's a couple ways to make a 100 cc container. I can make it that flat, right, and I can make it really wide, or I can make it so it's like that. So it's super tall, but then it's super narrow. And so that's like high profile versus low profile. It's just kind of a simple way. And then obviously with the mods and mod plus, there's something in between that. So that's kind of what profiles mean. Here in this practice, we like to often have the patients tell us just what is it they want. Show wish pictures. We use this thing called Vectra, where we can kind of try to show you what a certain volume will look like. And then try to, we ask our patients to allow us to kind of really help them with the profile selection, because I want to match that to your chest width, right? Some people with 500 cc's need a high profile, and some people who are 500 cc's need a moderate profile. And so that just kind of depends in that regard, kind of where to go from there. All right. Taylor is then, when can I fly home after a mommy makeover? So travel patients, for something like a mommy makeover, most of the time we're going to want you to stay in the area probably around a week, right? Somewhere around in there, somewhere around 5 to 7 days, because the idea is probably closer to that 7. The idea is that I would like to see you for your first post-op visit, right? I'd like to make sure that we don't have any kind of urgent problems such as bleeding or anything like that I need to deal with. And then once we're happy with kind of that you've gotten through that first acute phase, then it's okay to get back on a plane and go home and kind of do your recovery or drive back home. But if you live, if you wanted to try to leave, say certainly the very next day, and you're like hours away and you happen to have bleeding on day 3, which hopefully not, but can occur, then obviously then getting you back to the practice is a very difficult thing to do in that situation. And here we like to really take care of our patients. So I'm going to say probably for most places, probably around a week is probably how long they want you to stay for a mommy makeover. I have, what makes you a good candidate for a BBL? So I think really the baseline for the BBL is that someone who wants to have buttock augmentation, right? They're looking for more shape. They're looking for a little bit more size. Mostly it's shape. They're looking to fill in hip dips. The people who actually have the best candidates for this are people who want that change to the buttocks, but then they have a little bit of fullness kind of above the buttocks, right? Kind of in the love handle area or a little bit in the abdomen, and mostly that love handle area, because if I can carve in that love handle area to create more of a waist, that by definition automatically creates a little bit more of the appearance that the buttocks are a little bit wider, a little bit more shapely. And so from a surgical perspective, it is people have some extra fat to be able to do liposuction and then transfer, because that's what a BBL is. It's liposuction of fat from abdomen, thighs, lower back, upper back, bra line, and then transferring it to the buttocks, right? So you have to have some extra fat, you have to have some donor tissue, and then you have to have an area that I think I can actually address in terms of improving the shape. And then the next thing is the recovery is super important, because you don't want to be sitting on the grafted tissue. And so I tell people they have to be willing to go to bed or lay in a bed for about 3 weeks, right? So you won't be able to sit on your buttocks, you won't be able to lay on your back, you'll have to lay on your belly for about 3 weeks, either that or standing. And so those are kind of like the big things around like a BBL. So where do I get the fat, and then can you do the recovery? Because if you are in a situation where you're like, I have to sit and do, I have to drive for my job in 1 week or 2 weeks, I say probably not the best candidate, because we don't know how much of it is going to survive if you have to sit on it. But it's doable. It'd just be something we'd have to kind of talk through and go through the process. I'm going to scroll through here and see if I found any other questions. If not, I still have some on the computer that we can keep going through. I just wanted to make sure. So again, as you guys are kind of joining in, if you have any questions or anything you want to kind of go over or anything is on your mind, certainly post them and we can kind of go from there. So next thing is, if I get liposuction, does that mean I'll get loose skin in those areas, and will I need a tummy tuck later? So that actually is a really good question too, because this is something that I think comes up a lot. And so for people who already have some loose skin, liposuction is not a good idea. I don't think they're a very good candidate for it, because I tell people the skin retraction is unpredictable. And so what that means is that some people, you do liposuction and they get great skin retraction. Other people, you may do liposuction in some areas and the skin doesn't retract quite the way that you want it to. And in those situations, then you do need to do some sort of excision procedure. So oftentimes the people have had, oftentimes the people have had, say, a C-section and they feel like the tissue kind of hangs over top of it. Or if people have rectus diastasis, right, and they feel like they have a little bit of an abdominal pooch that kind of pushes forward just because their ab muscles are weak, those are patients that definitely need a tummy tuck because liposuction can't fix rectus diastasis, and liposuction can't address the scar from a prior C-section. And if you have skin that already hangs over, then it's only going to make it worse. And so then after that, when people have, say, a significant amount of stretch marks, I tend to often encourage them to do tummy tuck over liposuction because, again, as we talked about, when you have stretch marks, it means your skin is damaged and it doesn't retract quite as well. So it is possible that you could have some extra loose skin if you do abdominal liposuction and then ultimately need a tummy tuck. And so hopefully then that's a question that you kind of have with, or the discussion that you have with your plastic surgeon before moving forward, because there is kind of a gradation, right? There are some people who are just solidly liposuction candidates. Like the skin is tight, they've never had kids, they just have a little bit of extra fullness, but they don't have any loose skin. Perfect liposuction. And then on the other side, you have people who massive weight loss, right? They've lost 50 pounds and they have lots of loose skin, or they've had a few kids and they kind of have rectus diastasis and they have had a C-section, right? Those people are solidly in the tummy tuck camp. It kind of becomes in that middle ground as to whether or not I think you're going to have loose skin afterwards. And if I think so, then I kind of tend to push you towards the tummy tuck, or we have more of a discussion about the tummy tuck. Whereas if I don't think you need the extra scar and I think your skin may tighten, we're going to have to wait and see, then we may lean more on the liposuction in those situations to be able to avoid the scar and the recovery of a tummy tuck, which is certainly more involved in the liposuction. All right, next, what are some things I can do to speed up the recovery time from a tummy tuck? And then why do people have so much swelling for so long after a tummy tuck? All right, so in terms of speeding it up, so for any surgery that you have, I think the big thing to do for enhancing your recovery is making sure that you are hydrated beforehand, drink plenty of water, make sure you eat lots of protein, right? Make sure that you have that your diet is just, a nice kind of balanced diet. Some people like things like arnica to kind of help with some of the swelling. A kind of plus and minus on that, but if it's something you like, I think that's totally fine. I think the big things really are just making sure that you set up your house and kind of set up things like if you need childcare, having that set up. Are you going to sleep upstairs? Or are you going to sleep downstairs? Like, do you need to get a wedge pillow? Are you going to just use pillows behind your head and pillows under your knees? Are you going to sleep in a lazy boy? Are you going to have someone help you with preparing meals? Or are you going to need to prepare meals beforehand and kind of put them in the freezer so that they're ready to go kind of while you're recovering? I think those things that people don't necessarily think of are super important, because what you don't want to think about is on day one, after you just had a tummy tuck yesterday, is how are you going to get the kids to school? Or how are you going to be able to make dinner? Or you come home from surgery the day of and you're like, oh, well, how am I going to get up the stairs? Right? Those are the things you kind of have to think about beforehand, and will make your recovery much better. And then after that, in terms of speeding up our time here, we do a kind of rapid recovery, which is where we work on actually having people stand up straight, right? The natural tendency, and what I will do at the time of surgery, is I will bend you, I will flex you forward significantly, because I want to get out as much skin as I can. But the idea is then I need you to stand up. I need you to pull your shoulders back. I want you to try to get your back flat. We do these wall exercises where you're trying to get as flat as the wall, because the more you can stand up, the more that will help your recovery and the better you'll feel about the recovery process. That, and again, then afterwards, drinking lots of water, eating a nice healthy diet, those things will kind of help you with recovery. And I think just moving, right? I think that patients tend to be more successful when they tell me that they are doing some things around the house, right? Not necessarily rearranging the furniture, right? But they're up, they're moving. They went to the grocery store, they're doing these things. They went to somebody's game, as opposed to kind of trying to sit in one place, because when you sit still, your body gets sore. Your muscles get used to not moving. And then when you try to move them, it's a stretch, it pulls, it's tight. So you want to be moving and kind of keep things nice and loose. And then why does it swell for so long? Your guess is as good as mine. Now, I kind of say that with a little bit tongue in cheek. So swelling just lasts a long time. It's annoying, but that's just your body's response to injury. There's not a whole lot you can do to speed it up. People will do lymphatic massages, which can kind of help make it go a little bit faster, because the idea is that you have fluid that's kind of sitting in these spaces, and then you have these things called lymphatics that basically act almost like drainage pipes and drainage system. And it just takes some time for them to absorb all the extra fluid. And so the lymphatic massage kind of helps with that a little bit. Massaging, sometimes people think a garment because a garment it limits the space that you can swell. And so the garment kind of holds things in place. And so that is why some people either like to wear a garment for, an extended period while they're doing activity and then they'll take it off at night. Or sometimes people like to wear a garment overnight and then kind of take it off during the day. But having some sort of garment so that your swelling just doesn't get too out of control. I do think that over time, ultimately at around a year, maybe a year and a half, everybody kind of hits the same equilibrium, right? It's just there are a couple things that you may be able to do to make it go a little bit faster in terms of swelling. But it's just, and I tell all my patients that up front, it's annoying. Just be prepared that it's going to be there for a long time. And you just, at some point in time, once you've been cleared by your surgeon, you just go back to doing normal stuff. You go back to working out, you go back to traveling, you go back to doing anything you want, and you just realize that I'm going to have some swelling, and if I have a busy day, I may swell more, but it will go away, and it just takes time. Next, should I ask for mesh with my first breast augmentation, and what is the benefit or risk of adding it? So I am in the camp that does not necessarily believe that you need mesh for your primary breast augmentation. Reason being is that most people don't need mesh for breast augmentation. I mean, it's pretty straightforward in that regard, right? So you could be adding something to someone as an added cost as well as an added risk because mesh is not free, right? Mesh is another foreign body that has its own risk of infections, risk of feeling it, risk of complications that are otherwise associated with the mesh. And so you can be adding things to people that really they just don't need. So I do not think that most people need it at a primary breast augmentation. However, there are people that if you get bottoming out, if you have had massive weight loss or your skin is really loose or some other reason why the skin is just really, really loose and you're worried that you don't have enough support with an augmentation, then in those situations, then a mesh may be more useful, right? Particularly with the bottoming out. Because what it's used for is to help control the pocket. But for most people, the tissue is strong enough, they have enough natural support that you don't necessarily need mesh at the time of a primary augmentation. I do know that a lot of people will say that they offer, or some people will say that it's offered as and billed kind of as an internal bra. And that kind of, I think, is more marketing, I think, than it is in terms of being more useful. For some people, again, I think I'm glad that mesh is there, and it certainly is useful. And I've used mesh. I just don't think it's necessarily at a primary augmentation, again, because most people who get a breast augmentation don't need it, right? To be honest in that regard. So it is not free, right? Again, it comes with its own set of risks in terms of infection because it's another foreign body, and it is expensive. So next thing is, how does getting implants affect workouts? And do people have to change the way that they work out because of them? This is another question that I like because I actually enjoy kind of having super healthy, fit, active patients. And I like to kind of probe them for all these things to figure out what it is that they're doing. And so ultimately, over the long haul, I don't expect implants to affect your workout at all. There's always a question of over the muscle versus under the muscle, right? And so certainly if the implant goes over the muscle, it will affect all of your workouts less because none of the muscle has been damaged. None of the muscle has been interrupted, right? The implant will then sit on the top of the muscle. You'll take 6 weeks off, and then you kind of will work yourself back to where you were. The big talk always becomes when it's under the muscle because in order to get the implant under the muscle, I have to release the muscle somewhere, at least a little bit. And when I'm releasing that muscle, then there's always a question of, okay, well now how do I work out and how does this affect my body? And so when it's under the muscle, the way that I explain it is that your muscle is used to pulling in a straight line. Now your muscle has to pull over top of something, right, in order to be able to contract. And so that's a new movement. And so your body has to get used to that new movement. I do tell people that how many push-ups they could do when I see them in consultation. I expect them to be able to do that many over time. But it will take some time. And it will feel weird when you start doing it because, again, the muscle has a new movement. But by the time people come back for 6 months, by the time they come back for a year, a lot of my patients are already back to bench pressing. They're back to doing CrossFit workouts. They're back to doing pull-ups, push-ups. I even have some patients who say that they're doing more at 6 months than they were beforehand because they're actively pushing and kind of trying to work through it. It will feel weird, right? And that's kind of the big thing. Weird is okay. I tell people there's a difference between weird and painful. If it hurts, then don't do it, right? They kind of let your body be a guide. But if it just feels a little bit strange, but you feel like you can go through the movement, then I think you should do it. And I tell people to start with the motion, right? If you're doing a bench press, start with just the bar, right? Start with a push-up on your knees, right? Some sort of modification so that you can feel the range of motion that you can get started. And then as you kind of feel like you get stronger and you're used to that kind of weird sensation, then add weights. And then in that situation, you can kind of get back to it. But I fully expect everybody to be able to get back to all the things that they were doing before. Again, whether it be bodybuilding, whether it be CrossFit, whether it be Peloton, whether it be running, anything that is that you wanted to do. An implant over the muscle or under the muscle should not limit you from doing any of that. What will happen though, just to be for full clarity, is that the speed at which you get back to that stuff, right? So if it's over the muscle, I do tell people you'll get back faster, and it makes sense, right? Because the muscle is intact, and at 6 weeks, I tell you can go back and you jump back into it. When it's under the muscle, at 6 weeks, I tell you can go back. You got to work back up to where you were, right? You got to get used to this new movement. But again, it's one of those things that even though you start faster with over the muscle, you will end up at the same place as somebody who had it under the muscle, ultimately. All right, so those are great questions that were posted into the group. Let me see it. I'll refresh to make sure I don't have anything else. One last question, I guess, that kind of that I have from May or Mai that kind of comes off of that last question. If it includes fat grafting with the implants, would lifting or cardio impact the results? So when you have fat grafting, the big thing you're going to want is that for the first couple of weeks, you aren't going to want to put any pressure on the fat grafts. And so ultimately, in that same kind of, if you get it at the same time as say you get a primary augmentation, for us here at this facility, if you're waiting 6 weeks just for general healing, that's also enough time for the fat graft to take effect. And so once I've cleared you to lift from an implant perspective, you can lift also from the fat grafting perspective or do cardio or anything like that. I don't expect it to affect your results. The one thing that fat grafting could do in terms of cardio is that if you then lost a significant amount of weight, the grafted fat is fat, right? And so as you lose weight and as your fat cells shrink, those fat cells could themselves shrink, right? And you may notice a slight change in the appearance in that regard. But your general cardio, just to work out, just to make sure you kind of stay healthy, or general lifting, I don't expect it to give you any issues. I encourage people to fully get back to normal and do everything. All right, let me see if I have anything else there. There's nothing else on the computer. Let me scroll through here to make sure I don't have anything. Make sure I don't miss anything. Perfect. All right, friends. Well, it looks like we covered at least all the questions that are there. I thank you guys for submitting questions, and I thank you guys for tuning in. Again, I'm Dr. Hunter, and I am with the Amelia Raleigh group. And I do think, again, we're going to be showing this on Instagram. So if you are watching this on Instagram, again, I encourage you to join the Bustmob main Facebook page, bustmob.com. And it's been a pleasure. I always enjoy it. So I'll see you guys again in about a week. Put a post at that time. But if you have any other questions that you think of between now and then, please feel free to shoot them at me. Or if you have questions, you can ask in the Bustmob Ask a Surgeon group. I'm also in there as well. You guys have a great afternoon. It was a pleasure meeting you.